Hi, I am Wing. I'm going to share about the term paper part A. First, the screening assessment. S- Screening assessment is the first step in determining students' readiness for on-grade level instructions, and this is an early intervention tool to determine which young children are at risk for developmental, behavioral, and academic difficulty. The benefits of screening assessment is it is very brief and conducted with all students from a grade level, and is always easy to identify those who deviate from norms. So for screening assessment, and here is the examples of one of the kind of screening assessment and how it's related to children's developmental and usefulness of screening assessment. And it can help with teacher for provide valuable information about each child's interest, strength, and needs. And it is more easy for teacher to create a tailor-made goal for the children, and it can use to determine further assessment too. For the comparisons of screening, developmental, and diagnostic assessment, for screening assessment is brief and easy to do, and is used to determine further assessment and identify students who are at risk or for not meeting grade level learning goal, and is identify children at risk for the developmental delay who should be referred for further evaluations. And for the developmental assessment, is more flexible and is identify possible developmental problems and identifies the needs for further diagnosed evaluations and monitor signs that a young child may be delayed, and also is used to get information about child characteristic and their ability, and it is less formal and done on a regular basis. And for the diagnostic assessment, is complete progress that may identify special developmental disability and is identify strength and area of improvement for the student, and it to provide the most appropriate education for the individual situation for a child, and is allowed for continuous evaluation for our young children too. For the cooperation between school and early intervention team. For the potential-based interventions, the role of the teacher will be the supporter, observer, teacher assisting, and communicator and cooperator. The reason that there will be a supporter because children will go to the center and have the intervention. So the teacher only can be the supporter, like they will support the SEN teacher with like their daily school daily routine, or maybe some observation form that they have do it in the school, and they will be an observer and the teacher assisting. They will assisting the SEN teacher to create a curriculum for the child, and it's a communicator which is communicate with the SEN teacher and also the parents, and they will be the cooperator to cooperate with the SEN teacher. And the role of SEN teacher will be the organizer, observer, communicator, and a private tutor too. The reason that they will have organizer and private tutor because they need to organize a curriculum plan for the children and be their private tutor to giving them the best curriculum plan for them to get improvement. And for the school-based interventions, the role of the class teacher will be organizer, observer, facilitator, and communicator. And they will need to organize the classes a class in the big groups, and they will be the organizer to organize a curriculum plan, and they will need to do some activity with other children too, and they need to communicate with the SEN child's parents, and also the SEN teacher too. And for the roles of SEN teacher, they will come into the school and they would be a private tutor of the children, and they need to observe their the behavior at school, and also they need to be a counselor, and they need to always update the children progress and their improvement, and also they need to cooperate with the class teacher and the parents too. For class teacher, like they need to assign the time that which the SEN teacher can come into the classes like this. And this is the end, and this is my reference page. Yeah, that's it.